This course is called boot camp because it's much like boot camp for the military. You're sent off to a place where someone yells at you, they break you down, and they build you back up. Well, the good news is we won't be having any profanity, we won't be having any yelling in this course today, but we will be doing some things that will challenge you as a therapist. We're going to talk about some things today such as anatomy, modalities, therapeutic exercises, different therapy techniques such as scar management, wound care, all the things that we do in everyday practice that sometimes we perform the skill but not necessarily know how to do the skill correctly or why. So hopefully by the end of this course you'll have a little better understanding of what you're doing as far as a therapist. So first of all, I'd like to say welcome to boot camp. So take a moment, stand up, drop, and give me 50. No, just pick it. Just sit back down. As you can tell, I don't work out a whole bunch except for the remote control. So hopefully you can sit back and enjoy the course, and let's just have a good time. So let's take a look at the thenar muscles of the hand. Again, we discussed this earlier when we looked at our hand just to become familiar. The thenar eminence being on the thumb side of the hand, and you can appreciate its supple appearance right there. The thenar muscles, again, because they're on the thumb side of the hand, they function with movement of the thumb. They are of utmost importance for opposition for the thumb. Without their activity, the thumb is more or less just dead in the water. It's unable to function normally and perform prehension and opposition for the hand. There are three muscles that make up the thenar eminence. They're the opponens pollicis, the flexor pollicis brevis, and the abductor pollicis brevis. So let's take a look in the schematic. We can see the opponens pollicis. It's innervated, just like all three thenar muscles are, by the median nerve. Its action is to flex the thumb at the CMC joint level. The flexor pollicis brevis is innervated by the median, but also a branch off the ulnar nerve, and its action is to flex the thumb at the MCP joint level. So we have the flexor pollicis brevis, but then also the abductor pollicis brevis, which is very important for the thumb because it's innervated by the recurrent branch of the median nerve, but it helps us to be able to abduct the thumb, which helps us to prepare for opposition or prehension type task in the hand. And now it's time to look at how to assess grip and pinch strength in the hand. For most patients when they come in, a lot of times their complaint, especially if they're workers and they're laborers, their problems will be mostly related to a lack of strength, whether it be for grip or pinch, which helps to inhibit them performing their daily tasks in a normal level. Now, grip strength is often seen, if you look at other therapists and you look at people performing in the clinic, it's often performed very wrong because most of the time we just simply hand the patient a goniometer, just like this JMAR dynamometer here. We hand them a JMAR dynamometer and we ask them just to squeeze it with all their might. And that already invalidates our score, because that's not a correct way to get a mechanical advantage for an accurate strength test. We can see on a JMAR dynamometer, we can either buy these, which are hydraulic, and have just a regular dial gauge, or now on the market you can purchase digital dynamometers as well, which are of course much more expensive. But on the dynamometer, we have actually 5 positions, or 5 rungs, that we can adjust for settings for testing the hand. If we want to test the hand, we can test it on either position number 2 or 3. Most standardized testing calls for testing on position number 2. However, I like to use it on number 2 for women, but for men, especially if they have a larger size hand, I like to use position number 3. So for testing for grip strength, if you take a look at the picture enclosed, you'll see that we have the patient position in a sitting position with the elbow flexed to 90 degrees, the forearms in a neutral position, and the wrist is in a slightly extended to neutral position, and then we ask the patient to exert full grip with one quick motion to try to move the dynamometer. Now, one thing that you should remember to tell your patient is let them see how it works, because a lot of times they're going to give it all their might and they don't feel it move. So a lot of times they think that it's broken. So you need to explain to them that they will be gripping and it won't feel like it's moving, but it is. Ideally, you would like to test 3 trials in order to get an average, but sometimes patients will fatigue rather quickly and it's unable to get a good accurate measurement. However, if you do test grip, you need to test both sides in order to have a comparison for your measurement. This is the most effective way to test grip strength in the hand. Now we've taken a look at passive exercise. Let's look at active exercise. When used to maintain joint mobility, active exercise should be performed through the full available range of motion. Composite motions, such as fisting and thumb opposition to each digit, should be encouraged as they reproduce normal functional activities. When active exercise is used to restore mobility in the presence of increasing tissue resistance, fast ballistic movements are discouraged by instructing the patient to maintain the in-range position so that the gentle stretch can be applied. When active exercise is used to restore motion in stiff joints, care must be taken to ensure that the corrective force is directed toward the stiff joint and not dissipated in the adjacent normal joints. Let's take a look now at some of the exercises we have available performing active range of motion. For the elbow, one of the best exercises that can be performed in the clinic or at home is using a Swiss ball or just a simple inflatable ball or Pilates ball that can be purchased at a sporting goods store or other outlet center. For performing elbow active range of motion, you'll have the patient position the ball at a level that positions their elbow at 90 degrees of flexion to begin with, and you'll have the patient actively push out to extend the elbow, trying to achieve maximum range of motion, and having them maintain that position for a hold of 3 to 5 seconds, and then they can actively pull back, therefore flexing the elbow, trying to stretch those structures that are involved. The Swiss ball roll is effective for using this for the shoulder as well as for the elbow, and we'll see it later used to also help perform stretching exercise for the wrist as well. With the Swiss ball, we have availability of different sizes that can be used, and we also can have the patient perform them at different heights and different levels to get an effective stretch. Let's take a look at some exercises that can be used to perform active range of motion for the forearm, for pronation and supination. One option that we have is the wrist roll, which is simply just a dowel that is used with a rope attached to accomplish a certain amount of motion, and you can even apply a hook at the bottom for attaching a weight for resistive training a little later on. The nice thing about the wrist roll is that you have the availability of changing the size or diameter of the dowel by purchasing a different size wooden dowel or using pipe as well, and therefore you can change the amount of composite flexion and grasp that the patient is able to perform when performing this exercise. So just to basically show you for forearm pronation and supination, if my hand here is affected, I would have the patient with the unaffected hand hold the object here, and then they would start hopefully in a neutral position, and then they would actually grasp and turn, performing supination and pronation of the wrist roll. The nice thing is if you have it done in a standing position, you can have them perform it for the full length of the rope that you have applied, and therefore they have feedback to see how much motion they're accomplishing. Most patients, however, like to perform this incorrectly because they'll actually simply use just their fingers and turn to perform the motion. So it's critical that you monitor the patient to perform this exercise correctly in order to make sure that you monitor full forearm pronation and supination as they perform that exercise.